The latest on the coronavirus, 1,834 new cases today in Illinois. That's the most in 5 days. But the number that really stands out is this one. The state breaks the 200,000 mark for total cases. And this week marks 5 months since it was deemed a pandemic. CBS 2's Chris Tyne live at McCormick Place with why Chicago is on the list of cities doctors worry could see a spike in the fall. Chris.
Brad, first, let's talk about that 5-month mark. The experts in this line of work say there are 3 real headlines. Local and state leaders in Illinois and Chicago doing a far better job than on the national level. 2, Illinoisans are doing a pretty good job with the mask wearing, hand washing, social distancing. But it's those who aren't carrying their weight by doing those 3 things. The ripple effects of their behavior far greater than most expected. When summer vacationers come home this year, they'll be bringing back more than just memories.
They do things in more crowded areas where they're picking up more infections, and then they bring it back to their hometown. And it doesn't really matter if your hometown is small or big. If you have enough contacts in that hometown, you can start a pretty bad outbreak.
That's the forecast from the Children's Hospital of Philadelphia, too. Their policy lab, which studies regional spikes in COVID, have tremendous concern for large Midwestern cities like Chicago and Milwaukee this fall. Newly infected individuals from summer vacations is concentrating risk in their urban neighborhoods, they write. And we would not be surprised to see vacation areas ebb while city epidemics continue to grow, namely among 18 to 29-year-olds.
That age group definitely is letting us down. I think we could have done better with nursing homes in the beginning, but now I think we're getting that under better control.
5 months into the pandemic,
it's the first COVID positive facility in the country.
Experts say Chicago will be remembered as a leader in the early days in building out McCormick Place as an alternate care facility.
We might start seeing a surge.
And Rush University Medical Center, building out triage in their Welcome Center for non-COVID overflow. Both have now returned to normal, but those treating life as normal, they are the biggest risk, experts say, to what's next.
The few who are really getting an F, honestly, are going to bring it down for the rest of us and make it so that the rest of us experience life as though we all got an F. We asked Dr. Landon, what are the 2 storylines you're watching moving forward? And you can remember it by TV. Easy to remember here, right? T for testing. She goes, testing is a real problem because schools, universities are promising some families will test kids every day to make sure the campus is safe. She says there's just not that kind of supply available. V is, of course, the vaccine, and it's not just developing the vaccine, but it's then distributing the vaccine to every corner of the country and then trying to convince people that it's in their best interest to take it. Live at McCormick Place, Chris Tyne, CBS 2 News.